And I'm one of the Prevail e-nurses, and this education is created for the National Healthcare Associates. Today, we're going to talk about Prevail products and product selection. We're going to talk about sizing and also application. I'm going to start with the least absorbent product and work our way to the most absorbent product. The bladder control pads are going to be for what we call stress incontinence. So coughing, sneezing, laughing, dribbling. This is our 16-inch bladder control pad that is on your formulary. You'll notice that it has an adhesive strip on the back and that this would stick into regular underwear. So we wouldn't put this into another disposable product. This will go in regular underwear. The next product that we're going to talk about is our protective underwear. You may know them as pull-ups. The sizing will go from small all the way up to a 2XL. They're all white in color. You'll have a stamp in the back with their size. So the one I have is an extra large, and that will go to the back of the resident's body. These products are going to be for urge incontinence. So that means that the resident is still fairly mobile. They're trying to get to the bathroom. They have some void in their protective underwear, and then they finish on the toilet. So they're not completely emptying their bladder in this product. Now you'll notice with this product that it has very stretchy side panels. It's soft. You're not hearing any noises. Their products are not plastic backed. And that they look like regular underwear. And that's what they're meant to do. They're meant to look like regular underwear, look and feel. Now with this product, we want the part that goes in between the legs right up close to the body. So if you're putting the product on and you let go of it and it starts to inch down, it's too big. We'll want to drop that size down. The other thing that I want to mention is we don't want to double pad. So we don't want to put a bladder control pad that holds less into a product that holds more. If you remember, I mentioned that the bladder control pad has an adhesive backing. So if I was to take a pitcher of water and pour it onto this, nothing is going to go through. Same way if they had a void, none of that urine is going to go through this product and down into the protective underwear. It's just going to go along the sides. The other thing that we want to remember is it will not wick away from the skin like it should if we are using the wrong product absorbency. So that puts people at risk for urinary tract infections and skin issues if that urine can't get away from the body appropriately. And that's what we see with double padding. So again, urge incontinence, stress incontinence, dribbling, not a void. If you have a resident that is wearing a protective underwear, and let's say we took them to lunch today, they didn't say anything to anybody about needing to go to the bathroom, and then you went to take them back to their room and they have completely soaked through their protective underwear, they're not in the right product. If you have a resident that still wants to wear a protective underwear type of product, they're still mobile and they do try to go to the bathroom some themselves, then we may want to look at what we call a pant liner for this particular resident. You'll notice that one end is a little bit shorter than the other. So this end goes to the front of the body. This is to the back of the body. This is a one size fits all product. It has an adhesive strip on the back of the product, and this will go into regular underwear. Again, we don't want to put this into another disposable product, but this will give them the coverage that they need if they do completely empty their bladder, but it would go in their regular underwear so that if they do try to go to the bathroom on their own, they'll have the coverage that's needed. And again, it's a one size fits all, and this one's called a pant liner. Now we're going to spend some time talking about the tabbed briefs. The sizing is a little bit different. So you're going to notice that we have a size 1, 2, and 3. Size 1 is white, and it's going to be like a medium. We have our size 2 that's blue and like a large. And then we have our size 3 that is kind of a yellowy beige color, and that is like an extra large. Then we also have a bariatric size as well that goes up to 100 inches around. Now let's spend a little bit of time talking about the brief. The first thing that you're going to notice, and this is the front of the product, is that it's very see-through around the edges. You can almost see me through the product. And it's going to look exactly the same way on the back of the product. You can almost see me through the edges of the product. We do that for breathability. We want the skin on the outside to be the same temperature as the skin on the inside of the brief. That means that that skin is breathing, and that's what we want it to do. Remember though, the part that goes in between the legs, that will give us the absorbency that we need. Now, on the tabs, you'll notice that they are very, very stretchy. But if you look at the stretching and where my fingers are, I'm stretching them in the middle of the tab. If you have the resident's weight on the back of this and you try to stretch it around by an edge, sometimes you're going to have this first seam pop off, and we certainly obviously don't want that to happen. So when you bring it around by the center. Once you get the product around and you're wanting to secure it where you choose for it to go, once you bring it around, get it in the area that you want it, and then give that product a rub, and you'll be able to pull. It will stay in place, but the beauty of it is that you're going to be able to move this tab if you want to readjust, and you can readjust this tab over and over. You'll find that it's a Velcro-like product, meaning that it sticks like Velcro, but it does not have teeth like Velcro. So you're not going to have to worry about this damaging the resident's skin. It's just flat to the touch, so there's no teeth. But you will be able to adjust it over and over. If you find that the tab is popping off, just find your spot, give that a rub, and it will stick. You do have 2 wetness indicators. That's the 2 gold lines that you're seeing here on the front. And those will turn kind of a blue-green color once they detect moisture. As far as how often you check and change the residents, I will refer you to your corporate policy, and if you have questions, please ask your director of nursing. Now let's look at the inside of the product. On the inside, you have what we call an acquisition area. That's the section right here, and we want that touching the perineum. If I was to cut this product in half here, you'll notice that it has a dual core. And what that means for you and your residents is that when they go, they'll go in this top section, and then it will go down to the bottom where my fist is, and that urine will stay locked in the bottom, meaning that it will become dry again on top. Good for your resident's skin. Now, sometimes people will ask about barrier creams or zincs. Can we use those? The answer is yes. However, a thin layer on the resident and not actually on the brief itself. You'll notice that the brief, when you look at it, has teeny tiny little holes. And if we put the product right on that, right on the brief, it will block the holes, and then that will cause leakage. So you want to apply it to the resident's skin at a thin layer, use as recommended on the products. Now, as far as application of the products, we want to get, as I mentioned, the part that goes in between the legs right up close to the body. So if you have a resident and they can stand after they go and we need to change their brief, what I like to do is take the product and fold it in half so that that portion is sticking up. If this is their perineum, I bring it right up into the perineum. I fold it out flat, and then I bring it up so that I get it right where I want it. If I have a resident that's laying down, what I like to do, so I'm going to bring it across the front of me here. You'll do your pericare and you'll get the old brief out per your corporate policy. Once you get the new brief under them, and let's say my left hand is their new brief, we get that under them. And then what I like to do is take my other hand and I like to pull the product taunt up here. And then in one motion, I like to bring it up and I'm getting it right up into the perineum where I want it. What happens sometimes is if they're contracted and they can't open their legs very well anymore and it's hard for us to get that brief inside, sometimes what I see is we're trying to bring it up this way. And what happens is it results in shearing and we see some redness and irritation in the inner thighs, and we don't want that. So again, we want to bring it in one motion up in between the legs. And I always say, especially with females, we do all this work and we get them changed. And then if we don't quite get it up there, we lay them on their back. There's a gap there, and then the urine goes straight down the back of the brief and then goes right up their back. And we certainly don't want that to happen. Normally, when I see leaking, we look at a couple of different things. We look at, are they in the right absorbency of product? Are they in the right size? And is it applied correctly? Sometimes people think, oh, if they're a heavy wetter, the bigger the brief, the better. And that's not true. The bariatric brief is going to hold the same amount as our regular briefs. What happens though is a lot of times if we have them in too big of a brief, they actually have leakage because there's so much gapping around the leg panels. So we want to make sure that we've got them in the right size and applied correctly. The other thing, when I mentioned sizing, look at where the product hits on the body. So what you'll want to do is when those tabs come around, and remember I mentioned those tabs are very stretchy, they're only going to come around to the front of the hip bone. So you only want them to come up to the front of your hip bones. You don't want them to come into the belly or cross over. That's going to be too big. You want to make sure that it's right on the front of the hips. If you have problems with sizing or you want to move to a different size, please talk to your central supply and director of nursing and have them review the patient and see if they do need another size. What do you do if you have questions? How do you reach us? I'm going to show you a slide because we are available 24 hours a day. So we do have a nurse on call. It's not an outsourced number, available to help you any shift. That's the phone number that you see at the top, 866-573-3776. You can also email us at enurse@prevail.com or chat@prevail.com. You have help no matter what. Please reach out to us if you have any questions or if we can help in any way. Thank you so much for attending our product education today.